Good morning, everyone. 11 a.m., time for us to get started. Welcome to the Sustainability Talks. It's our first and only sustainability talk for this Wednesday, and we have one more lined up for you tomorrow at noon. So thanks, everyone, for tuning in. We really appreciate your support. So this is a part of Texas A&M's Virtual Earth Month, also in conjunction with TRACS, the Texas Regional Alliance for Campus Sustainability. And so for today's sustainability talk, we have Thomas Jistel. He is a public health major with the class of 2021, and he has a really interesting presentation for us today. He's going to be looking at the homeless population and relating that to COVID-19 and what we've seen, the impacts of COVID-19 on that population and what that means for the rest of us as well. So just a couple pieces of housekeeping. We hopefully you have some questions over the course of Thomas's talk. And please, when you have a question, put that in the chat. I will look at those at the end and ask all of those questions to Thomas. That would definitely make our experience more enjoyable if we have some great conversation after the fact. And also on the top, you'll see the little green bar, and it'll say my name that is sharing my screen. And if you click on the little dots next to it, you can put yourself in side-by-side mode, and that is the best way to watch Thomas's presentation. And also, you can turn on the live transcript if you would like to see a transcript happening on the bottom of the screen as well. So without any further ado, I'm going to hand it over to Thomas. And whenever you're ready, Thomas, if you want to start sharing your screen and take it away.
Okay. Like Ben said, I'm Jistel. I'm an intern here at the Texas A&M Office of Sustainability, and I'll be talking to y'all about the homeless population in the United States. So roughly 14% of Americans will experience this in their lifetime. There are more people of color in this group. They have little to no access to healthcare, and they're often portrayed as lazy or drug addicts. The condition, of course, I'm talking about today is homelessness. So often the media portrays the picture of a man with a long overgrown beard and tangled hair with raggedy clothes that's begging for money on the side of the street. However, this is not your typical homeless person. Usually someone of this description would be someone deemed chronically homeless, meaning that they have spent over a year on the streets and usually have some sort of disability. And they only make up about 10 to 15% of homeless populations. The other 85 to 90% of homeless populations are those that are called temporarily homeless. Usually they're just going through rough patches in their lives and lost their housing in the process. And home loss can be due to a variety of things, of divorce, job loss, mental illness, or a combination of them. And it can happen to just about anyone. Singles, couples, children, and even whole family units can lose their home. So you might be asking yourself by now, how does this fit into sustainability? Well, there are three perspectives to sustainability, one of which is environmental, which is what most people think about when we talk about sustainability. And the next is economic, which deals with maintaining a stable economy. And finally, social sustainability, which deals a lot with racial and gender equality and overall community health. And homelessness can be talked about from any of these three perspectives. But for this presentation, I'm going to mainly focus on social aspects. So in the United States, there's a common ideology that if you're poor, you're lazy, and if you're wealthy, you're very hardworking and very intelligent. This is called the meritocracy, or a society where power and wealth is determined by your skill or ability. We're told if you work hard, get good grades, go to school, you'll be almost guaranteed a job to be successful in life. But in reality, this is often not the case. And this only happens to a very select handful of people. And the Americans, in truth, Americans start out on completely different playing fields, depending on what class your family's from. Those from wealthy classes or even middle class families have significant advantages compared to those starting out in poor families. Take these kindergartners, for example. Those from families with higher incomes get significant advantages, especially to their reading and math skills, which will impact them throughout their whole life, especially compared to those from poorer families. And again, when it comes to higher education, we see that your class, the wealthier your family is, the better school you can go to, which then again perpetuates poverty within the United States. So here we have your class ranked from increasing on the left side, and whether or not a high school graduate went on to college. So you can see less than 40% of high school graduates went on to a four-year college, while in the top percentile, over 90, almost 90% and above went on to a four-year degree. And opponents often use meritocracy to justify defunding policies that often help people in poverty, and especially minorities, by painting them as uneducated, greedy, or lazy, such as with the idea of welfare queens from the 1980s. In addition to this, numerous studies show this is simply not true. There are also multiple studies that have shown welfare expansion can improve economic output because more people from across all classes can afford improvements to their quality of life. Ideas such as housing first, universal basic income, SNAP or food stamps, and universal health care have all shown to greatly reduce poverty and reduce homelessness and increase overall life expectancy. So there are many stereotypes that often prevent people from investing in homeless populations. I'd like to debunk a few of these misconceptions today. The first is that the homeless are lazy. This harkens back again to our societal belief in meritocracy, that if you're poor, you somehow messed up in life and almost deserve to be poor. However, data from the Bureau of Labor Statistics has shown that families that receive government assistance, such as housing aid, Medicaid, or food stamps, are consistently employed and still make less than half the average American family, around $33,000 compared to the American average of $72,000 in 2014. In addition to this, 74% of SNAP or food stamp participants worked within a year of being on the program. And the other 26% mostly cite caretaking responsibilities or disabilities that limit their ability to work. The second misconception is people choose to be homeless. And I don't know about you, but I don't know very many people who choose to live without access to clean water, some form of shelter, electricity, food, or healthcare. People do these things because they cannot afford them. In addition to this, mental illness can increase your risk of becoming homeless, which is why 20 to 25% of the homeless population is mentally ill, compared to only 6% in the general population. But why don't homeless people just get a job? Well, homelessness itself is a barrier to getting a job. With limited to no access to hygiene or sanitation supplies, it's often hard to perform well in interviews, and you often need a permanent or home address to even apply for an interview. In addition to this, there are many homeless people that do have jobs and are still homeless, particularly in places with expensive housing markets. You see, in areas with fast economic growth, housing demand rises faster than new homes can be built, which increases prices and rent without increasing wages. This often forces people on the streets that would not have been otherwise. My hometown of Austin, Texas, within the past year, has been implementing policies to solve its homelessness problem that has resulted from the past decade of fast economic growth. One of these policies was housing first. So since the early 1990s, many state and local governments have experimented with housing first policies, which are initiatives that emphasize getting those experiencing homelessness housing above sobriety, employment, or service participation. Here are a few principles behind every housing first program. First is that you move people into housing directly from the streets and shelters without any preconditions. Second, the providers are obligated to bring support services into the housing. These services are based on self-engagement and not coercion. And finally, providers embrace a harm reduction approach to addictions rather than mandating abstinence. And at the same time, the provider must be prepared to support resident commitments to recovery. So why does Housing First work? Well, Housing First policies use the belief that housing is the key to solving the issues surrounding the homeless, and including health issues that often implicate these populations. As opposed to conventional methods where the individual often has to prove sobriety, can be screened for motivation, or requires a willingness to participate in engagement programs even to just receive housing. Housing First is also effective because clients can figure out their situation on their own time, and the programs often individualize support for each person. By doing so, there's no pressure of losing your housing by not meeting any arbitrary deadlines set forth by program providers. It is also more cost-effective as programs do not have to spend vital grant money on services that are rarely used. When in these programs, clients are more likely to have access to the health services they need, which has significantly reduced emergency room visits as well. Programs have shown improvements to housing stability and an average reduced cost of about 30% per individual. Additional studies have shown that there have been great increases to overall quality of life within these homeless populations, and especially within veteran homeless populations. So how has COVID-19 impacted our homeless population? Well, homeless have little to no access to clean water, showers, toilets, or even the more recently coveted toilet paper. This leaves them unable to follow the CDC's top rules for fighting the pandemic, which is staying home and washing your hands. Shelters and encampments are often very cramped and over capacity, which increases transmission for diseases not only for COVID, but also other illnesses like tuberculosis and influenza. So what are local governments doing to help out these homeless populations? In cities such as Austin and San Francisco, hotels are being rented by local governments to house our homeless populations during the pandemic. In addition to that, numerous churches and convention centers have been converted into health clinics to take care of sick patients, both homeless and not. And here is the Cathedral of St. John the Divine in New York City. They actually cleared out all the pews within the cathedral and erected triage tents inside. And the CDC and Department of Housing and Urban Development have also stressed the importance of housing access for the homeless community during this time. They've also suggested not clearing homeless encampments in cities. This can spread the virus to other places throughout the city. And finally, many local governments are having significant challenges, both finding funding to fight the pandemic and protect their homeless populations on their budgets. So there are already large risks associated with being homeless when there's not an active pandemic going on. Finding food, being arrested for sleeping in the streets, and showering are all daily concerns for homeless people. These, coupled with the pandemic, multiply risks, and their limited access to shelter or water is no longer available. Recreation centers, restaurants, libraries, and food banks are closed on limited staff, which leaves the homeless populations that rely on these buildings during the day without access to the services that they provide. In addition to businesses, many homeless shelters were temporarily closed to help prepare for the pandemic. In cities like Las Vegas, the city had to paint squares of living spaces in a parking lot to ensure social distancing while their shelter prepared measures for the pandemic. This got a lot of negative attention on social media. And as we all know, the CDC recommends washing your hands for at least 20 seconds with soap and water about once every hour. However, without access to water, homeless populations are unable to do so, nor are they able to meet their daily hygiene needs. So cities across America are providing portable toilets and hand washing stations to their known encampments during the crisis. And finally, what are some things that we can do to help? First is to make sure you continue to educate yourself and others on homelessness. Over this presentation, I've debunked some common misconceptions about homelessness, so make sure others understand them too. Second is to help support funding and services that will help reduce poverty within your area. And understand that healthy individuals mean a healthy community. The healthier individuals are within a community, the less likely diseases like COVID-19 will be able to spread. And finally, food banks and shelters are always looking for volunteers or donations. Here in Brazos County, we have the Brazos Valley Food Bank. They can help Brazos County and the surrounding counties. And within the Texas A&M University system, we have the Health Can. And these are some of my sources. I have a lot more than this, but I felt like these are good starting points if you wanted to do more research for yourself.
All right, great. Thank you, Thomas. That was very, very well done. Definitely very informative. I think it's really important, that we understand that homelessness is a problem in the United States in general. I think you definitely, I think some of the myths that you debunked, just what you typically would stereotypically think of someone who was homeless, and then the actual reality of the population. I thought that in particular was really something that we can all think about. But then just how this pandemic is really accelerating these issues. So the first question that I would like to ask you, Thomas, is you mentioned, healthy individuals mean a healthy community. And I've also heard like a statement before where basically the sentiment is that you're only as safe or as healthy as your most vulnerable person, in society. And I was just wondering if you could maybe say a little bit more about that.
Yeah, definitely. And we talk about this a lot in my public health classes, like really the most vulnerable populations are usually the ones most heavily impacted by like outbreaks and transmissible diseases. So really the overall community health impacts those populations a lot more than the rest of the community. And if we take care of those populations, our overall community health will be a lot better. And if everyone has access to, say, like healthcare, we can all more easily take care of everyone across communities, basically.
So when you said that it would make all of us like healthier and safer, what do you kind of mean by that? Like, how would us, taking care of the homeless population in this pandemic make the rest of us that are, even if we're able to be at home, how would that make us safer?
So, well, when we talk about like homelessness, they have lowered immune systems, so they're more likely to catch transmissible diseases, and they can then spread it around to different areas, which that basically increases transmission, ability for viruses and outbreaks to transmit across communities. So even if you don't necessarily come in contact with someone like a homeless person, someone you may know may have, and that sort of web of like interlocking interactions can really quickly transmit diseases. And so by limiting points of access within the community and making sure everyone is healthy, that can reduce transmission for everyone else.
Great. Okay. Yeah. Thank you. That makes good sense. The great answer to that question. And then the other question that I was going to ask you is, have you looked into homelessness within our own county or within our own cities, College Station and Bryan? Is that something you were able to research at all, or were you more focused on the kind of larger stuff?
I was more looking at like policy and like larger like implications to homelessness. There are a couple websites that we do use. One of them is like countyhealthrankings.com. You can look up your county and it'll tell you a bunch of very like basic health information about your county, one of which is homelessness. It tracks homeless populations, and it's usually updated quite regularly.
What was that? What was the name of that website again?
Countyhealthrankings.com.
Countyhealthrankings.com. That sounds like a really great resource.
Yeah.
All right, well, those are the questions that I wanted to ask you. Now let me look to the chat. We got some questions in the chat here. So first, you mentioned that many people that are experiencing homelessness are employed. Did you notice a trend in types of establishments that do not pay their workers a living wage?
Yeah, so a lot of retail and businesses and service businesses often don't pay their employees a living wage. And this has become a problem, especially within areas that require a higher standard of living with expensive housing markets or expensive healthcare markets, just expensive cost of living in general. These populations are often either forgotten about or left behind due to the minimum wage being so low.
And then would you say that some of these jobs that these folks are working in, with some of those are like the essential services that are still open while during this pandemic, and so they're working in essential jobs that are supporting everyone, but they're not able to sometimes even afford a place to live? Is that what you're saying?
Right. Yes.
Oh, yeah, that's really powerful. I think that's something for all of us to really consider and think about. All right, so now we have another question. If there was something you could do, and they're saying don't think about the cost, because obviously that complicates things, but if there was something you could do that would help homeless people during this pandemic, what would that be?
Honestly, like just going out and like either not necessarily visiting a shelter, but like all the shelters right now are extremely over capacity and lacking resources. So I know they're taking a lot of donations of medical supplies, of food, of bedding, and any sorts of those resources. So I would definitely check into that and look into that within your local area and within your county and city district.
So that sounds like a great thing that individuals could do. We could help out. Great. And then I think you also mentioned earlier, donate and volunteer at food banks as well as another great way you could help out.
Yes.
So another question we have here is, in your research, did you find any particular level of government, local, state, or federal, as being most critical in solving this challenge?
So local governments are definitely the ones that are on the ground level interacting with most of our homeless populations. However, local governments do get most of their funding from the federal level, which distributes the money to all the local governments through grants. And so I would say local governments are definitely the most key aspect to receiving grant money. They tracked populations, and that's how money is distributed based on the number of homeless people are in your area. So, and definitely the local government is the one that is on the ground and really helping distribute that money and making sure homeless people have access to those essential services.
All right, great. Thank you, Thomas. So it looks like that's probably all the questions that we're going to get in the chat at this time.
Okay.
I think did a great job answering those questions. Really informative presentation. And other people in the chat are saying, also great job after the questions they asked. And thanks, you gave us a lot to think about. We have another great job and nice work, Thomas. So, great job, Thomas. Thank you. And then I'm going to give my little virtual round of applause here. Well, I guess, yeah, other people want to clap too. Some more great jobs. Amazing in the chat. So thank you, Thomas. Wonderful work. Thanks for all your effort on that. And then just so y'all are aware, this is our, we have one sustainability talk left. Our final event for Virtual Earth Month is going to be tomorrow. It's at noon. And Kendall is going to be there, and she's going to talk to us looking at some different responses. What have different countries done in their COVID-19 measures, and how has that kind of impacted what we've seen unfold in those countries? And Faiza talked about that earlier yesterday, but Kendall is going to take a different approach. And just like you saw, if you tuned into our very first sustainability talk, Jessica talked about homelessness, but she looked at it more from kind of a historical point of view. And Thomas looked at it more kind of currently what is happening. So you can see, even if it's a similar area, there's so much more to learn, so much more to discuss. So I just encourage you to tune into those and just continue to build your knowledge about what we see happening in our world and how COVID-19 has accelerated that. But again, hope everyone tunes in tomorrow for our final sustainability talk. And thanks everyone for tuning in today. And also great job, Thomas. But everyone take care and stay safe, and hopefully we'll see you back tomorrow. Oh, the time of the talk tomorrow is at noon. I have a question in the chat. It's at noon.